In this video, you're going to learn why sometimes you feel like you're getting the exact same adjustments each time, but sometimes it's not true, and often it's not true. Good morning, Dr. Craig Dingman, Elevate TV. I'm here with my assistant Karen, and today we want to teach you that sometimes it may feel like you're getting exactly the same adjustments or corrections each time you come in, but in fact, often it's not the case. So Karen, if you can just turn around for me. So I'm going to use the example of the lower neck, because it's pretty easy to demonstrate. I'm just going to hold your hair up here, Karen. So if we look at the lower neck, so for example, C5 is right here, C6 is here, C7 is here, T1 is here, and T2 is here. So that's about a 4-inch space along the spine where there's 5, 6, 7, T1, T2. There's at least 5, possibly 6 different vertebrae. And especially to a new chiropractic patient, I could be adjusting C6 or C7, and it would feel probably exactly the same to you, even as much as C5 and T1, and that's 4 segments apart. I could be adjusting those 2 different areas from day to day, and they could feel exactly the same, particularly to a new patient. So that's great. Thanks, Karen. Appreciate it. So the other thing I want to explain is that when a patient starts, I actually will expect that for a certain length of time, perhaps weeks, even months, I may be doing the exact same adjustments. You could look at my notes and I may be adjusting C6 on the right, time over again and again and again, 7, 8, 10, 12, 15 sessions in a row, 15 checkups in a row. And I expect this to happen in the beginning because oftentimes patients, when they start, will come in with a pattern of subluxation or misalignment in their spine, and it can take weeks, sometimes months, to break that pattern and correct that pattern. The flip side to that is, a patient may be coming for years potentially for wellness care, for proactive wellness, and they may appear, and they quite often will be getting the same adjustments or similar adjustments most times. And I would say often that's the case because people drive to work, they work at the same desk, they work at the same computer, day in, day out. So if they have the same patterns of activity, they're going to have the same stresses and strains on their spine week to week. And I think that's probably the homework that I give, the data roll, the corrective exercises, the stretching, the strengthening, maybe some lifestyle recommendations that I make, those things would come into play to help break that pattern. But I do expect oftentimes if people are doing the same occupation at the same workstation, the same types of activities day in and day out, they will have the same pattern of subluxation. And I hope that makes sense to you. I know I've heard this question a lot from patients. So the short answer is that sometimes we are adjusting the same places time after time because they need it, and other circumstances we're adjusting different areas. It just feels the same because of the proximity of the different corrections to other areas of the spine. I hope that makes sense. Please share that out. You may have friends who are chiropractic patients who are wondering the same thing. If you have comments about this or questions about this topic or other areas of your health, please ask them. Just leave them below in the comment area. I'll get back to them as soon as I can. Thanks for watching Dr. Craig Dingman, Elevate TV.